back on. Here's the coracoid coming here. Can I have a radio frequency now? So then, so we're, I was talking to everybody else. I'm going to talk to my patient. So we're now looking towards the inside of your shoulder. This is the... I'm going to give you a little bit of a reference point in a minute. This is just a little bit of adhesion tissue. So I'm going to back up a little and give a reference point here. So if I back up this way, here is the supraspinatus tendon. Kind of adhesions and everything I was commenting before, but I don't know why. That's just for whatever reason. Sometimes people have nerve problems, they get these. But for the most part, the tendon looks absolutely normal. This is a cannula. The instrument you see here, the tip of the instrument is probably about 3 millimeters or so. So the supraspinatus muscle is there, the tendon is there, I mean. Release a little bit more of this tissue out of the way. And so then I'm going to drive down here. And the reference point is here. And so I'm removing some of the tissue in front of the supraspinatus cuff tendon, which is tethering a bit, and I'm going to make a space here. I want to emphasize everything's magnified, and if you look up here, it's starting to come into the fossa where the nerve will be. The nerve's at least a centimeter away. So if I then that space a little bit. Nothing I'm looking at here is per se abnormal, just so that you know there's maybe a little bit more adhesion and scarring, and maybe that has something to do with the nerve. It's not entirely clear. It's usually a little bit thinner here, but again, it's usually doing this in normal patients that are totally normal. So I'm into the fossa now, and that means the space where the muscle goes, and the nerve is going to be over in that way. So I'm going to take a little bit more here, and then I'm going to put a special instrument in that's going to help me with the a little bit. Just take a little bit of this stuff in the way. Rotate up a little bit. Very hard for you to reference this, but for surgeons to reference this if they don't understand the anatomy, and suffice it to say that this is going inward in your shoulder. Okay, so now I'm going to park this down here. It's down out of my way there. Now I'll take a spinal needle, please. So up here's where we're going to go. So I'm going to insert a little needle here and see where that's coming through. It's going to come through right here. Okay, and that's exactly where I want it to be. So now if we pull that out for me. Yeah, take it right out. Thanks. Now I'll take a blunt trocar. So now this is right behind the clavicle kind of where I'm putting this. I'm going to put it down here. Here comes my blunt trocar here. And as I do this, I can sweep the tissues a little bit away. Gil, I need you to come behind me. Thank you. So if you hold, my assistant holds this here, we're going in the right direction. So I'm going to now just keep going over towards where the nerve should be. I'm going to kind of fiddle here a little bit. If I'm looking here, what's my best angle? That's good. Can I have this for a minute? This is my device. So I kind of keep going along this way. Hold this here for a minute and just focus a little bit. Good, thank you. So the top of the coracoid's coming up there. So hold this right here. That looks like I'm in the ballpark. Keep that right there. here. Get rid of this bubble. Come on, bubble, go away. There we go. Good. Okay. So I'm going to go this way and look with my hand. There for a minute. I'm going to have this. So if I come here, we're coming towards where I think we need to go. Yep. Hold this up here like that for a minute. I'll rotate this upward here. Sorry. This is going to be the ligament up here. See it right there? So this is the edge of the coracoid bone, and the ligament is coming right here. And if you would just hold this right here, I have to clarify that a little bit, but that's the ligament right there, underneath which the nerve runs. And we wind up with a much tighter space, and the instruments get tighter, manipulated to put in the right place. And so I'm going to sort of slowly kind of clear away a little more space so I can see properly, but the nerve is going to be behind this. You'll see it once I release the ligament much better. Let's just tickle this a little bit. Jump because of the muscles there. Okay. Leave that there. Now, let me just focus this. Hang on one sec. Very tight. Can I have this? Nerve is right there. That's in right there. There we go. There's the ligament I'm going to release. Now, can I hold this at the top? Can I have a sponge, please? So can I have a spinal needle? So now I'm going to make a little parallel portal, which is the orientation for me to actually be able to release the ligament. Hopefully. Gently hold this like this, just like that a little bit. Question of access and real estate. There we go. There I am. That's where I want to be. There's my device. Okay, can I have a sponge again? Now I will give this back, take a knife. Thank you. And then take my special cutting device. Thank you. This is a special blunt tip device that allows me to cut properly. So it's got a blunt tip and another tip that opens. This part opens here to cut. There, and I think if I sneak under parallel to you, there I am there. That's underneath the ligament. This is what I'm going to cut right here. And just orient myself to show it a little better. And that may be the best view I get. Okay, so there we go. What I'm doing is releasing the ligament that I think is tethering the nerve. So now you see we're wide open here. Don't move anything. Give this back. So, relax this. Here is the nerve coming right past this instrument right here. There's the nerve, that thing right there. Hold this here for 1 minute. This cord-like structure running here that looks kind of yellowish, that's the nerve. Hold that again gently. If I rotate this way, bring it back here, it's running into the fossa. It's very small. It's only several millimeters. You can sort of see it here. You can imagine how it would be stuck underneath this ligament here. I'm not going to do much to it here, but that's clearly the nerve that's free. Let me take a picture. Hold this one more time. If I back up this way a little bit, the nerve's running right into the muscle, which you can almost see the fibers of it there. And that's definitely beautifully released. And I'm going to go release it a little bit on the hold this right here, as it goes around the corner to the other muscle. Let's just see if we see the artery pulsing. Let's see. A little hard to see in you. Hard to see. Okay. All right, so the nerve's free there. Now we're going to back up. Again, reference point, there's the fossa. Pull this out, give this back to you. This is the coracoid bone coming here. This is the edge of the coracoid. Here's the supraspinatus coming here. And now we're going to rotate, look upward, and we're going to work up here a little bit. So, can I have a sponge one more time? And then I'll take my radio frequency again. Thank you. So, let's just start through this, first of all, if we can. Ran through all of this stuff here. So I'm going to just work up at the ceiling and clean off some of the tissue. I'm coming to the back now. Here's the acromion bone here. I want to kind of clean that up. Please. Give that back for a minute. And we're going to use this to pull the tissue down a bit. So here we are here. Gil, hold that like that. Can I have a spinal needle, please? And we're going to make a little accessory angle here. There we are there. Knife, please. And I'll take the blunt trocar next for the moment. Thank you. Okay, great. Now I'll take the radio frequency. So the acromion, the roof is up here. I'm going to take this here and work from the top down, preferably. So here I am right here against the bone here. Can we put the pump to 70 just for a moment? Yes, thank you. Sorry you're not seeing much right now. That's just used to the moment. Okay, a little better view. Can I borrow this for a minute? I don't like where that's going yet. Hold this here for a minute. Just all this stuff in here I think needs to go. Stuff in the way. Back this up for a minute. We don't have to just hold that there for a minute. Here. healthy looking muscle. Now, can I give this back for 1 minute? Let me just take this and see if I can make this work to my advantage. Where are you? Here we are. So if you hold that like that, that's a little better. That's definitely better. And can I now have the radio frequency again? Good. Great. Good, good, good. Lots and lots and lots of bursa. Just put this here for a minute. Where are you? You're right here. I'm going to sneak you a little bit this way. That's great. Right there. Hold that there. Good. Perfect. I'm going to look down this way. So this is the spine. The nerve is going to be coming somewhere around that. Sorry, these are big muscles. No surprise. Even though you think they're atrophied, I'm seeing here. So I'm going to release in here, and if there's a ligament that could be tethering the nerve, it will be released. The nerve is going to be down in this fat here. Can I now have the blunt trocar? Okay. So this is a little blunt trocar, and I'm going to kind of tease in here, and the nerve's going to be coming around the corner there. I'm just sort of pulling this stuff off here. Soft tissue. This, see that there, that yellow? That's probably the nerve going around the corner. The muscle is here that the nerve goes into. That's the infraspinatus in the back. I'm around the spine of the scapula. Don't see anything tethering it. That could be one of the motor branches there. This looks a lot less stiff, if you will, or tethered than in the front. So for me, that looks pretty open. Nerve is no tension on the nerve. This fat nerve's in that. I'm not going to dissect it out. It looks wide open for you. Again, just to give a reference point, there's the infraspinatus around the spine. I'm going to back up in front of me. To the left is the supraspinatus. To the back is the infraspinatus. There's the supraspinatus muscle. Keep coming back like this. That's the muscle. If I come out, here comes the tendon. All the bursa I remove, the tendon is right out here. Where I just was, where I did the release in the front, is around the front of the supraspinatus. There's the coracoid. And I release the nerve up here, and it's kind of running down in there. So that's it. That's all there is to it. I'll see you in the recovery room.